in the future from you. Thanks so much.
Thank you
again.
very much. Thank you.
And the next speaker also comes from far away, from Korea. Korea Advanced Institute of Science and Technology. It's Professor Sangyong on multi-responsive nanovesicles.
Okay, thank you, Chairman. Actually, I am very pleased to be here. Actually, my first time in CLINAM, because I realized, there are so many stimulating talks. Also, it's very easy to make a very intimate relationship between, delegate. So I'm very pleased to be here. So far, as you know, a variety of nanomaterials have been developed to treat cancers and inflammatory disease, showing, either better efficacy or, lower toxicity to conventional regimens, right? So they have been mostly used for, some drug delivery purpose or the imaging probe. However, toxicity associated with the some de novo synthesized artificial materials, inorganic materials, polymer materials, also the lack of a superior, therapeutic efficacy or, unfavorable, drug release behavior actually have limited their use in the clinical, in the clinic, right? So let me ask, these questions. So what would be the some idea or some must-have properties for those nanomaterials to become some idea or platform nanomedicine to be used in the clinic? So to me, materials per se should be non-toxic, also degradable, also the on-demand drug release in response to, either internal or external stimuli. Also, it would be great, the materials per se, function as, the drug delivery vehicle or carrier, as well as the therapeutic, some efficacy or medicine, okay? So from now on, I'm gonna try to convince you that, the bilirubin nanovesicles might have satisfied those unmet the needs. Also, bilirubin nanovesicle may become one of the suitable ideas of nanomedicine to treat inflammation or cancer disease. So let me explain what the bilirubin is. Okay? So bilirubin is the final metabolite of the heme catabolic pathway. So heme is once actually oxidized, metabolized in the biliverdin first, and then further reduced to bilirubin, which means the bilirubin is just final metabolite, okay, heme catabolic pathway. So yellow and violet pigment. So even several decades ago, the bilirubin was just considered as a waste product because bilirubin is, observed, seen in either, the urine or the feces. So that is responsible for the colorination of the urine or the feces. Okay? However, some increasing evidences accumulated in the recent 2 decades revealed that the bilirubin is actually very potent antioxidant, endogenous antioxidant molecules. So thereby, actually it can, it is able to scavenge various reactive oxygen species with high efficiency, thereby, protecting the cells and tissues from the oxidative damage, mediated damage. Okay. Also, if you type, the bilirubin as a keyword for Google search, you will find this description in the Wikipedia. So the individuals with high levels of total bilirubin may experience various health benefits, such as much lower incidence rate of having cardiovascular disease or cancers. Yeah? So to make long story short, I want to emphasize bilirubin itself has intrinsic anti-inflammatory, also anti-cancer therapeutic efficacy, okay? owing to its ability to scavenge ROS, as well as to modulate immune system. Okay? However, if you have too much bilirubin in your bloodstream, you will definitely have the yellow skins, as shown in this newborn baby with neonatal jaundice. Also, kind of yellow eyeballs, because of, as a result of some clinical jaundice. However, the bilirubin, jaundice itself is not a disease, just an indication that you may have something very severe disease, okay? So you may wonder why bilirubin is responsible for this kind of colorization in the skin and also eyeball. So if you take a look at this, the chemical structure of a bilirubin, you will find very many hydrophilic residue in these bilirubin structures. However, it turns out bilirubin is totally water insoluble, very hydrophobic, because this hydrophilic residues are participating in intramolecular hydrogen bonding each other, so resulting in very hydrophobic nature of bilirubin. Okay? That's why the bilirubin during circulation has become deposited in the various tissue, including skins and also the eyeball. So we know bilirubin has intrinsic anti-tumor or as also anti-inflammatory therapeutic efficacy. However, we cannot use the bilirubin for biomedical application because of its totally water insoluble. So we will need to solve the problem behind the bilirubin's limitation. Also, we want to utilize the bilirubin for biomedical application, as well as we want to make the bilirubin based material also the response to the multi-stimuli. So the solution to the bilirubin current problems are very simple, very easily resolved. We just attached polyethylene glycol molecules to this bilirubin through the via this amide bond formation, make it PEGylated version of a bilirubin. So PEGylated bilirubin is amphiphilic, water miscible, so there is a little chance for PEGylated bilirubin to be deposited in the skin during circulation or not accumulate in the body. Also, this PEGylated bilirubin, when it meets water, what will happen? As you expected, or I did as well. So PEGylated bilirubin may be self-assembled into certain nanostructures, okay? So as indeed, PEGylated bilirubin formed very uniform sized nanoparticle size of less than 100 nanometer. Also, if you take a look at this magnified image of this TEM, so you'll find this bright band around here, this periphery site, which suggests this bilirubin, actual PEGylated bilirubin forms some vesicle-like structure rather than some aggregate version of bilirubin. Okay? So we have now bilirubin nanovesicle. Okay. So what kind of application is possible with this PEGylated version of a bilirubin nanovesicle? So I'm going to show you the potential application of bilirubin nanovesicle for anti-cancer therapy, was mediated by some light responsiveness. Okay? So newborn baby with neonatal jaundice is treated by phototherapy in the clinic, which means just exposing this newborn baby to a blue light of around 450 nanometer. So what happened? So why the clinician treat the baby using this blue light? So the principle behind this treatment, phototherapy, is quite interesting. Here, this is a bilirubin, it's water insoluble. However, upon exposure to light, this bilirubin undergoes photoisomerization and resulting converted to the photoisomer, both of which have higher water solubility, which means the bilirubin is converted to from hydrophobic to hydrophilic molecule during this photoirradiation. So we can recognize this phenomena and apply this principle to our bilirubin nanovesicle. So as you expect, this bilirubin nanovesicle encapsulating drug, upon exposure to light, what will happen? Suddenly, this bilirubin is converted to water-soluble photoisomers. There is switch, high solubility switch, and resulting in the disruption of this kind of nanostructure, and thereby, releasing drug outside. Okay. So to demonstrate that, we encapsulated doxorubicin anti-cancer drug successfully into this bilirubin nanovesicles with 100% encapsulation efficiency, believe it or not. Also, as well as high the capacity of around maximum 23 weight percent. Okay. So as you see here in dynamic light scattering measurement, so initially 120 nanometer in size, but upon exposure to 450 nanometer light, within 1 minute, those nanoparticles suddenly disrupted. It's all gone. Okay? Thereby releasing the encapsulated doxorubicin drug very rapidly. So within 5 minutes, over 80% of doxorubicin was successfully, is released outside. Also, this light-induced disruption behavior was also observed at 650 nanometer, is the longer wavelength near IR light, showed a very similar, phenomena also through release profile. Indeed, bilirubin nanovesicle, as a result of the EPR effect, so-called EPR effect, successfully preferentially accumulate in tumor site. To make long story short, in the human lung carcinoma subcutaneous model, this doxorubicin-loaded bilirubin nanovesicle showed actually this is doxorubicin alone, free doxorubicin. Interestingly, this bilirubin nanovesicle just alone, without any drug encapsulation, showed a better therapeutic efficacy than doxorubicin treatment, which means, as I mentioned, bilirubin itself has intrinsic anti-cancer properties, such as anti-angiogenic effect. Also, the doxorubicin-loaded particles showed much better. Finally, this doxorubicin-loaded bilirubin nanovesicle in combination with light showed the best anti-tumor efficacy. We didn't see any, appreciable the body weight loss. Anyway, let me switch gear to another application about the bilirubin nanovesicle, which is for treatment of anti-inflammation disease. So as you know, ROS, reactive oxygen species, play a crucial role in pathogenesis or progression of many inflammation diseases, either acute or chronic. So the bilirubin nanovesicle can effectively scavenge ROS, also modulate immune system, which means it can inhibit some inflammation. Also, this bilirubin nanovesicle exhibit some ROS responsiveness. This is a bilirubin, but once bilirubin is oxidized to biliverdin, what happens is initially water insoluble, but becomes a water soluble biliverdin. Okay, so this solubility switch upon this redox cycle also can be applied to make this ROS responsive nanomaterials. So this bilirubin nanovesicle, upon exposure to ROS, which is very abundant in the inflammation site, then the particle will be disrupted like this way. So this ROS response in triggered disruption behavior of bilirubin nanovesicle was also confirmed in direct measurement. Also by naked eyes easily recognized. The 0 minute yellowish color, which means typical color of a bilirubin, is converted to greenish color which is the typical color of biliverdin. And eventually no color was detected, meaning that these chromorphous structures of bilirubin, the color structure is entirely broken down upon exposure to ROS, which means PEGylated bilirubin eventually will be degraded during circulation and then excreted through the kidney and finally go to urine. Go time limitation. I'm going to show you just one example of the efficacy of a bilirubin nanovesicle in one inflammatory disease model. So we prepared this DSS-induced colitis model in mice. Actually, we have 3 groups. Group 1, just normal mice. Group 2, this colitis-induced mice, but treated with PBS only. But group 3, the bilirubin just a single intravenous injection we did. Okay? Actually, we examined whether this bilirubin nanovesicle can preferentially accumulated in the inflammatory site. To do that, we encapsulated ICG into these bilirubin nanovesicles and intravenously injected the vesicle and got this result. As you see here, normal mice, we couldn't see any bilirubin uptake in the inflammatory colon site. However, this colitis-induced model, we observed a very higher intensity around this inflammatory colon site, which means our bilirubin nanovesicle could be preferentially accumulated in the inflammatory site. Also, we monitor the therapeutic efficacy and body weight change. This is a colitis-induced model, but bilirubin-treated group showed almost close to normal. Also, that is true in the colon length measurement. The colitis model showing very shortness of colon length as well as the bleeding around this colon. However, bilirubin nanovesicle treated group showed almost a normal appearance. Histological level, also the final colon damage score clearly indicates our bilirubin nanovesicle is a very effective nanomedicine able to treat this colitis-induced disease. Also, safety evaluation we did. So bilirubin nanovesicle, even though we injected 150 milligram per kg, which is almost the 60-fold higher concentration than normal bilirubin physiological range, but didn't show any the toxicity in hematological assay toxicity evaluation as well. All right, so we believe bilirubin nanovesicle actually could be a platform nanomedicine to treat various oxidative damage related disease ranging from cancers to inflammatory disease, either chronic or acute. So we are currently actively working on, to expand the application of the bilirubin nanovesicle to various diseases. Okay. All right. Thank you for your kind attention. Thank you, Shane.
Thank you for describing, at least for me, a very novel nanomedicine.
Thank you.
And I would be surprised if there is no question.
Just a quick question. I know in some of the earlier studies with free bilirubin has been shown to be nephrotoxic. Do you see any toxicity in the kidneys?
Yeah, that's a very good question. That's why we actually convert the bilirubin to PEGylated version of a bilirubin, because PEGylated bilirubin is made via the amide bond, very stable amide bond. So there is little chance or no chance the PEGylated bilirubin is just released, just a free bilirubin during circulation. So almost PEGylated bilirubin will be excreted through the kidney. So there is no concern about that. Yeah.
Yes.
Okay.
Yes, thank you for your talk. As far as I understood, you illuminate these vesicles
Yeah.
by blue light, and then they undergo like a chemical reaction, like an oxidation or something,
Yeah.
turning into something more hydrophilic and soluble. Do you see any chemical interaction with the payload you have in these mice cells or whatever that is? Because you're forming basically, I think, radicals or something which could interact with the payload.
Yeah, right. So upon irradiation, so bilirubin is known to produce actual reactive oxygen species, but it's a very tiny amount of ROS, but which further trigger this bilirubin nanovesicle to be ruptured. But anyway, so there is, of course, some interaction between bilirubin molecules and the payload. That's why the doxorubicin, we got a very high loading efficiency or capacity in the bilirubin nanovesicle in the case of doxorubicin, because doxorubicin has a very planar structures, can interact with the bilirubin through the some pi-pi interaction or something like that.
I see.
Yeah.
Another question, if the chairman does allow me. You illuminate with blue light, right?
Yep.
Which is known not to penetrate too deep into tissues. Is that a problem?
Yeah, but as you know, as I show you, newborn baby with the neonatal jaundice is exposed to blue light, but it worked very well. Actually, convert the bilirubin to some water-soluble version of bilirubin isomers. But also, we also demonstrate that not blue light, 650 nanometer light also can induce that kind of, light-induced some particle disruption. Yeah.
Thank you.
Thank you.
So last question.
This is really an excellent
Thank you.
presentation and excellent nanoparticle. What is the problem of translation this to human use? Or when do you, how do you?
No, actually, I'm planning to translate our system into the clinical trial near term, because it's a very simple system. So bilirubin, endogenous molecule, is commercially available. It's just PEGylated, FDA approved. So we can make very easily this PEGylated bilirubin, also the resulting, the bilirubin nanovesicle as well. So we are actually,
But it is still, I think you did not very convincingly demonstrate yet that you need light or ROS. Maybe the vesicles themselves are almost or as efficient.
Yeah, actually, for clinical application, we are not going to use the light to induce this kind of particle disruption or drug release, because bilirubin nanovesicle, drug-loaded bilirubin nanovesicle, once arrived in the tumor, where also there are many abundant of ROS, so which trigger this kind of particle disruption and releasing drug in the tumor. So we don't have to, use actually light. Just ROS responsiveness is sufficient enough to have, effective cancer therapy as well as inflammation therapy. Yeah, both of them.
Thank you for sharing this all.
Thank you.